How does a CBC test diagnose sickle cell disease? Imagine a simple blood test that can give doctors a lot of clues about your health. That's what a complete blood count test does. It looks at different parts of your blood, especially red blood cells and hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen from your lungs to the rest of your body. In sickle cell disease, this hemoglobin is abnormal, which causes the red blood cells to change shape. Instead of being round and flexible, they become sickle-shaped or crescent-shaped. These sickle cells don't move easily through blood vessels and tend to break apart faster than normal cells. When a doctor orders a CBC test, they measure how many red blood cells you have and how much hemoglobin is in your blood. People with sickle cell disease often have anemia, which means their hemoglobin levels are lower than normal. Usually, normal hemoglobin levels are above 11 grams per deciliter, but in sickle cell disease, it can be below that. This low level shows that the blood isn't carrying oxygen as well as it should, often because sickle cells break down quickly or aren't produced enough. The test also measures the reticulocyte count, which tells how many immature red blood cells are in your blood. In sickle cell disease, this count is often higher because your body tries to make more red blood cells to replace those that are destroyed. Sometimes, the white blood cell and platelet counts are also higher, especially during sickle cell crises, because of ongoing inflammation or stress in the body. But it's important to remember that a CBC test alone can't confirm sickle cell disease. It gives important clues, like anemia and abnormal blood cell counts, but doesn't directly identify the sickle hemoglobin. To definitively diagnose the disease, doctors need to do more specialized tests. These include hemoglobin electrophoresis, which separates different types of hemoglobin in your blood, or genetic testing to look for the sickle cell gene. In everyday medical practice, the CBC is useful not just for initial suspicion but also for ongoing monitoring. Doctors can compare current hemoglobin levels to previous results to see how the disease is progressing or how well treatments are working. During a sickle cell crisis, the CBC can help assess the severity by showing how much the blood counts have changed from the usual baseline. So, in summary, a CBC test is a key first step in spotting potential sickle cell disease by revealing anemia and abnormal blood cell patterns. These results then lead to more specific tests that confirm the presence of sickle hemoglobin. This approach helps doctors diagnose and manage the condition effectively, always emphasizing the importance of personalized medical advice. If you or someone you know has symptoms or concerns, it's best to consult a healthcare professional for proper testing and guidance.